Well, hi, Anara. It's so fantastic to see you. I know it's been a few years since we've been able to connect in person, but really great to see you and just have this opportunity to kind of connect again about all the fantastic work that you've done. Specifically, I wanted to kind of chat a little bit more about some of the work that you've done with the research and practice and building those bridges, I guess. I think it's something that I've always admired about the work that you've done, and I wonder if we could just have a little bit of a discussion about some of the things that you've had an opportunity in those spaces that you've worked in.
Sure, thanks, and wonderful to see you again, Lisa. Been a while. Both when I worked with Children's Safety Network at their National Injury Prevention Center and also with the Suicide Prevention Resource Center. One of the most important aspects of that work was bringing research to practice. We would talk to researchers and read the articles and try to then translate those into ways that practitioners could not only digest pretty easily, but could do something with, put it into practice. A long time ago, in 2005, Zan Young from CSN and I, with the Suicide Prevention Resource Center, we did a survey of both state health department injury center injury programs and the CDC funded grantees, and brought those findings together. And it was really interesting to see the ways in which collaboration didn't happen, could happen, and occasionally did happen. I hope that it's more collaborative now than it once was. But it was interesting, and we presented the findings at a CDC conference, and a lot of it was, the different roles and them needing to understand each other's roles of what was priority. For the one group, obviously publishing is necessity. For the other one, it was more of a luxury. And yet without publishing, state health departments were often not given enough credit for the work that they were doing because their work wasn't getting out into the peer review literature. So that was just one finding, and I'll leave it at that for the moment.
Well, thanks for sharing those things. I think it's, we obviously know that uh, research and practice partnerships they're just so ripe with opportunity, right? We know that there are so many good opportunities to collaborate, and yet sometimes I think we forget about each other a little bit. And so while this isn't a new concept, I think it's something that we have to continually revisit. We've done a lot of work here at the University of Iowa's Injury Prevention Research Center, really trying to continue those collaborations because we feel like those synergistic collaborations, really promote translation of the research to practice. And so something that our center has been focused on here fairly recently is developing these research and practice action teams. And so what those are really meant to do is really leverage the expertise and the resources that both of what our research partners have as well as our practice partners. And what we're trying to do is bring them together around whether it's developing and engaging in all aspects of a project, identifying some project goals and maybe some metrics, but also then helping design and implement some of these interventions that we want to test, because we know that pooling resources and expertise really leads to more efficient, I feel like, research and implementation efforts. I think state health departments are just one of the key and critical partners that we have in the work that we do in injury and violence prevention. Without them, we wouldn't have our boots on the ground doing those types of things. Again, here in Iowa, we've effectively leveraged that partnership to work in some policy change areas. Specifically, I can think of, and this has been a number of years ago, but we've used our kind of our scientific evidence to inform child passenger safety laws, teen driving laws. I mean, those are just a couple of quick examples, but I think we can use it in program and policy change. And so I get really excited when I get to work with our practice partners. You can probably tell by my enthusiasm, but I think it's just such an opportunity that I think people, again, we sometimes forget about each other. We kind of get in our own silos and we don't really think to reach out. And so I don't know if you've experienced that, but it's something I think that we probably all need to continue to work to do a better job of making sure we can bridge that gap.
Absolutely. And I love that you're using the word partners over and over. That was a term that back when we did this study was not being used between the different audiences or participants. They were not referring to each other as partners. So even changing the language that we use is a great start to regard one another as partners in a partnership. That's a great first step and really shows some of the mutuality that's involved here.
Absolutely. And I feel like, wearing my researcher hat, I feel like we just as researchers can gain a much deeper understanding, of the real world challenges and things that are maybe more applicable to our partners than to researchers. And so being able to understand from each other's perspective is, I think it's just really critically important to move this work forward. So I appreciate all of my partners that I get to work with. So
And I'm not surprised to hear that Iowa is doing activities and forming these partnerships, because even back in 2005, partnerships in Iowa were one of the few active examples that we could find at that time that we could showcase to everyone who was at the CDC conference. So you all have a long history of building those relationships, as do others within Safe States Alliance.
yeah, absolutely. And I think it's just really kind of one of these neat things that we can point to in the way of like networking between, injury control research centers and our funded core SIP states, but also funded or unfunded. It doesn't matter. There's opportunities, whether it's through a regional network that we have or through just state to state through our academic institutions and things like that. So it's exciting to be able to kind of know that you've worked in this space, that the work continues, and that we're just really have opportunity to be able to continue those partnerships.
Networking is an important word too, because one of our findings was, as a first step, just to invite one another to your events, as a first step, even beyond having the shared events. So yes, and those opportunities are great. I miss networking with my injury prevention colleagues. And it's wonderful to be able to have this brief conversation today.
Well, and when you think about some of the opportunities for those networking, I'm just going to put in a quick plug here because we have a fantastic opportunity coming up at the Safe States Conference, which is, celebrating 30 years. And so I think it would be phenomenal if we could get all of our research and practice partners to attend that conference and really continue these conversations, because we know that a partnership, needs to continue for this work to continue and to flourish. So great talking with you, Anara. It's fantastic to make this connection with you again, and delighted that we could connect.
Likewise, and thanks for all you're doing for injury prevention, Lisa.